every time I get on live, I got somebody calling. Hey, y'all. Hey. Happy Friday. Welcome back to the Mom Nurse Fashionista. Oh, child, my lips is all chapped up. Listen, y'all know I keep it real over here on Mom Nurse Fashionista. I thank y'all for joining. If you catching the replay, I thank you for joining. Let's talk about it. Let's discuss this because it need to be discussed. It need to be talked about. So I want to discuss Black maternal health and racial disparities in healthcare. And nurses need to listen to their patients, and doctors need to listen to their patients because it's not talked about enough. And y'all know me, I'm going to talk about it. If it's nothing I don't like to talk about, it's about women in healthcare. It's about nurses not listening to their patients, doctors not listening to their patients. And now, in all my 38 years, I have never had to deal with racism in healthcare far as towards me as a patient. And child, so one of my family members, my sister had surgery today, and then somebody had commented on my video that I did last year in November, my 3-month update. What is that on my eye? My 3-month post-op update or whatever. Oh, maybe that's dry skin. A 3-month post-op update on my hysterectomy. I had a total hysterectomy. They removed everything but my right ovary. So I still have my right ovary. So everything else was removed due to endometriosis, second time of having endometriosis. So I was looking at that video. I was commenting, and I went back and looked at that video, and I was like, I never did an update. So I never gave y'all an update from my hysterectomy. So which has been going awesome. And I will do a separate video on that. But my video, the reason why I did this video was for several reasons. So listen, the first thing is during my recovery, I had started having chest pain and shortness of breath to the point that, mind you, my daughter was getting my kids ready for school every morning during recovery. I started having shortness of breath and chest pain. I had my surgery August the 9th. I started having it in September. And I didn't have on no bra or nothing, and y'all, it felt, you know how patients describe chest pain as an elephant sitting on the chest? I had experienced that, and I could not, it felt like I had a bra on, and I'm like, I had on this button-up shirt, and I just snatched the shirt off, and I'm like, girl, get me an aspirin. Like, I was like, I need some relief. I couldn't get no relief, y'all. She was coming back home to go to work, and I was like, I see how you feel when you come back home for taking the kids to school, and I ain't go to the ER, hard-headed. So then it happened the next week again. It didn't happen the next week. It continued to happen. And I was looking at Inside Edition or something, and it was a lady on there talking about heart attacks. And I was like, Lorna, you know better than this. And you can't ignore your health. But y'all, I was still recovering. Like I had a heart recovery. My recovery wasn't like quick. I was still having pain. I was tired. I was dizzy. My legs was heavy. And I realized that all of those symptoms was not related to my hysterectomy like I thought. So anyway, fast forward, I went to the ER like that next week. It got so bad, y'all. My heart rate was increased. I would be taking a shower, y'all, and I could feel my heart racing. So because I had so much pain during my 1.5 week of my hysterectomy, I was having excruciating pain. Like I was in a bed for 2 days straight just to get out to maybe make it to the bathroom. It was so bad. I wasn't hardly eating or nothing. So I had made a makeshift bed shower chair and I put it in my shower. Child, I was sitting down taking a shower, and my heart was racing so fast, and I was like, this ain't right, because why would I'm just sitting here bathing, sitting down. And I knew that wasn't right. So anyway, I went to the ER, and I had fluid around my lungs, all this stuff. There's like, it's not enough to keep you, go home, do this, do that. I followed up with my PCP. She tried to have me walk through the parking lot, and my heart rate kept increasing, but I was also short of breath, and she was going to send me straight to pulmonary, but then was like, maybe you need to go to cardiology. So I went to cardiology, got all the stuff done, Holter monitor, all the whole workup, everything they going to do, the heart echo, everything came back good. So I was like, okay, I should have went to pulmonary first. So the little helper, nurse practitioner. Now, if you're watching my video, I am a nurse. I will be a nurse for 12 years, right? And another thing, if you're on my channel, I'm gonna always speak my mind, because that's who I am. And I'm gonna always speak my mind. I'm gonna always tell it like it is, because that's what I'm gonna do. So Anywho, the little nurse helper, after all of the results came back, and she was like, oh, the Holter monitor, they basically just showed that your heart rate, average heart rate at resting is 76. It's normal for your heart rate to get up to like over 100. And I was like, how you gonna tell me what the hell is normal? Like, you don't know my body. And I was sitting in there and I was so frustrated, and I was like, girl, you gonna have to chill. Like, you gonna have to keep yourself calm, because I never experienced a doctor trying to tell me the hell about what's going on with my body, because that's not what you're gonna do. So then I was like, well, ma'am, you know, when I'm laying down, I feel something ain't right. You know, I have my own pulse. And I'm like, I have my kids. So what I would tell them, because I was going to bed different times, so I'd be like, hey, y'all, if you see me in here sleeping, put a pulse ox on my finger. Like, my heart rate would get so low during when I was asleep. I'm like, that ain't normal. And maybe this has always went on. And then they told me I snored. So then that's when I went to my primary, and I'm like, we need to get a sleep study done, because I think I have sleep apnea, you know. And so my doctor, I'm a nurse. I've had her since '08. So she done been through everything with me, you know, and we work together. She was like, okay, Miss Brown, what we gonna do? We got to figure out what's going on. And so anyway, child, the lady after the cardiologist, this is a nurse practitioner in a cardiology office, and she was like, but I'm looking at everything and everything came back normal. You're young and you say you have those kids, you probably not getting enough sleep, it's just anxiety. CB, that's not what we gonna do. And so I have not reported her, and I'm still gonna report her. I don't care when it is, because her bedside manner was sucky. She it's like she didn't care about the patient. I don't care how much we think we know because we went to nursing school. You do not know your patient. Like, you are not inside their body. Like, I hate that about some people in healthcare. Like, they feel like they big know-it-alls because they went to nursing school and medical school, and they can tell the patient what's going on in their body. And we cannot do that as nursing professionals. We cannot do that. So as medical professionals, we cannot do that. So that's the first thing. The whole reason of me doing this video. And I don't normally talk about stuff like this, so YouTube may not even show it, but I don't care, because I'm going to share it. Because y'all know me, I'm going to speak my mind. But my thing is, I just hate that people, medical healthcare professionals need to understand that you have to have bedside manner, and you have to show empathy. And you can't just go walking around telling somebody what they're feeling and not feeling, and that it's just anxiety. And it's just all in their head. Basically, it's what she was telling me. You know, like, I was tripping. And this is so precious to me, because I experienced the same thing when I was pregnant with my twins on bed rest at the hospital. My diagnosis, my admitting diagnosis was preterm labor. So if I'm telling you I'm in labor, it seems like you should listen to me, because I'm actually here for preterm labor. That's why I'm on bed rest. And I had 3 nurses not listen to me. And it was my bomb doctor, and it was my bomb PCA, who I actually used to work with her at that hospital, and she happened to be my PCA, and she was bomb. And you know, and I thank God for them. But at any rate, people have got to learn how to listen to patients, because unfortunately this is why Black women are dying. And you know, I know how it is. So I'm gonna keep talking. But at any rate, so this is why Black women are dying, and we cannot let one doctor, one nurse practitioner stop us from speaking up about our health and how we're feeling. So this happened. So I was like, okay, cool, I'm gonna go back. So I went back to the doctor, and then I ran into, and I know I should have had kept my PCP, but I needed to be seen because of shortness of breath, and everything was so bad, y'all. It was so bad. I'm like, I'm short of breath washing dishes. I'm short of breath doing laundry. This is after the hysterectomy. Like, 3 months later, I was good. I was back to normal activity. And I shouldn't be short of breath like that. I'm short of breath putting on clothes. I cannot bend over. I can't do all the normal stuff. And I'm young. Like, it's something going on. And so the nurse practitioner, my primary care doctor, wasn't available. So I got the nurse practitioner. And she put in the system wrong. So the insurance company denied me because she did not chart the correct way. And so she did not document the right way. And I'm telling her exactly what's going on, because I need you to put this in exactly how I'm saying it, so that these insurance people will approve me to go and get a sleep study done. And she did not. So again, everything got prolonged. I didn't even go get a sleep study all way into this year. All this was happening in October, November last year. And I didn't get seen. And you know, I had to pray about it. And I sent a very long message to my doctor and told her about that sucky nurse practitioner in her office, and she is of another race, and I don't care, because it is definitely racial discrimination. I don't care what nobody have to say about that. So anyways, so Fast forward, I got the sleep study, and I do have sleep apnea, and I do have to use the CPAP machine. Now, I haven't even talked about that on here, but as women, we have got, as black women, as women of color, we have got to speak up for ourselves. So then my doctor ended up putting me in a pulmonary referral, and God bless this man. He is freaking bomb and awesome. His bedside manner is everything. And then his attending doctor is a doctor that I used to work with at the hospital. And so I knew I was good, because I remember how he was with his patients, and he is good. But I say all this to say, you cannot stop when you know something is not right with your body. And I knew something wasn't right with me not being able to breathe. Okay, like I'm walking not even up one flight of stairs, and I got to stop in between that one little flight because I can't breathe. And I never was like this before, So fast forward, the pulmonologist, he told me, he said, I think this is related to COVID. Did you have COVID bad? Which I did. If you watch my videos from 2020, I did have it bad. He said, I'm seeing it so much. That's why I left cardiology and I went into pulmonology, because I was like, we have too many patients that are showing up years later and needing us, and we cannot have a shortage, right? So a shortage of pulmonologists. So he was bomb. He was awesome. So they found out that I have asthma now. So, a lot of things just happened with COVID, unfortunately, and that's what happened. But the whole purpose of this video is to tell y'all, like, we have, as women, you have to speak up for yourself, and do not feel bad for speaking up for yourself, because this is just awful. Like, this is why people are dying, and they just ignoring us and not wanting to listen to us, and they acting like everything is in our head, but we're actually trying to, like, hey, something's wrong, and you're not listening. And throughout all of my different health issues, I've never had anybody, I have never experienced this. It's just with those two different nurse practitioners. And this is not to shame any nurse practitioner, but this is just to shame those who won't listen to their patients. And those three nurses, that's not even to say that those three nurses were of another race. So one of them was of my race, and she did not listen to me. So that part is just to say you need to listen to what your patient is saying and stop trying to be a know-it-all. I actually worked with a nurse. I was training with her, and she was trying to tell me how one patient not going to come out of this. And I'm like, what are you basing that off of? Like, you're not God. You basing that off a book? Because we have seen patients have strokes and they don't come back. Like, you can't base stuff off of books. Like, you have to listen to your patients. And that's why I had to come on here, because, baby, listen, one thing that you're not gonna do is try to tell me something about my body and I'm not gonna follow up with it. That's not what I'm gonna do. Like, we got to get down to the bottom of things, so anyway, I just wanted to come on here and just really express that, because I never came on here and talked about that, and I've been meaning to do it, especially when it's around NICU, like when it's around neonatal awareness month, when it's around prematurity awareness month, like all of that stuff. I have, I made sure that I talk about it on my Instagram, but I don't talk about it over here on my YouTube, and I feel like it needs to be stressed and talked about. So anyway, I'll come back on here because I actually have a couple of videos that I need to do about jobs that I've been finding, some bomb jobs for RNs, paying up to, God dog it, I think it said 150 or 134. Yeah. And then I wanted to talk about I've been having a couple of LPNs asking me about jobs that's best for them, non-bedside jobs. So it's some jobs that I've been finding, and they didn't understand what you do in that position. So I was like, oh, I never did a video on that, so I'm gonna do that. I'm gonna do a video on that. So those are two videos that I try to do today. I'm out trying to get a lot of stuff handled, so if I try to come on sometime or another, but I just want to put that video up. Y'all make sure y'all have an awesome day no matter where you are, and remember, no matter your obstacles, you will overcome them. And also, if you need help in finding jobs with your resume, if you need help in doing coaching, because I do coaching where I help nurses not leave the bedside, but maybe you want to elevate your career, and you could be doing more. You have all this experience that you've gained, all this knowledge, and you want to go more higher in your career. I got you. Okay, I also provide coaching and help you step by step, being your accountable coach and accountable partner, and making sure you are moving in the right direction. Okay, so y'all can always hit me up on lbcareercoaching@gmail.com, and I'll also put all of my ways to contact me in the description box once this video loads up. All right, y'all have an awesome day or night wherever you are. Talk to y'all again soon.